A very good evening to participants and delegates. Thank you for joining Shield Connect today. And today we have a special speaker from Secunderabad. And the speaker for the day is Dr. Narmada Harigal. And ma'am is going to speak on male infertility and overview of causes and treatment options. So let me give a quick introduction of our speaker. Dr. Narmada Hadigal, ma'am has done MBBS in OMC, DGO from GMC, DNB, MNAMS, and DPHA. Ma'am is a laparoscopic and hysteroscopy surgeon. Ma'am is fertility specialist and director for Narmada Fertility and Endoscopy Center in Secunderabad. So I welcome you, ma'am, on our platform today, and we would like to give you this platform further for the webinar.
Yeah, thank you. Good evening, all. Today we are going to discuss a few things about male infertility and overview of causes and treatment options. So in the last 2 decades, we understood that there is a gross contribution of the male infertility causes in the fertility itself. So previously, we always used to think that female share is the major in the infertility. They used to blame females for not having children like that. But whereas in past 20 years, we recognize that there is a major contributing factors are there in male, and so many sperm causes and hormonal causes and other things are there to cause infertility. So nearly about 40% of problems are because of with the male, and of course female factors also there, both 30%, and both together again 30%, unknown only 10% of infertility causes. Here what we will discuss, and previously in olden days, Dr. Stepoy and Dr. Edwards, they invented IVF in patients like whoever is having tubal damage and grossly damaged tubes, they did IVF. But whereas nowadays what we are doing, same thing we are doing for male infertility. So in place of female tubal problems, now in many infertility cases, if you see, male patients are more and they are having more problems compared to female patients. So the contribution is more from the male side. So we started doing IVF, ICSI, and IMSI, all these things mainly for the majority cases we are doing for the male infertility. Of course, nowadays infertility is very common compared to before. In olden days, the sperm count was really very good, and when we were doing MBBS, maybe it was in 100 million, something like that. But after so many decades, like 3 decades, we are seeing only barely 20, 30, less than 40, something like that. So every year the semen production and the quantity of this semen and the quality of these sperms coming down. So today we will discuss what are the causes, treatment options, and other things. Okay. Finally, we will discuss about doubts and questions. Thank you.
Ma'am, you can just press the arrow.
Otherwise, you guide me, sir.
Yeah, you have slide? Do you have slide?
Ma'am, you can just click the arrow, ma'am.
Yeah.
Yes, ma'am.
So, yeah.
Now we can go.
Coming to the definition of the infertility by the WHO, it is inability to conceive after having 1 year of married life with normal sexual activity without any contraception. So it is again as primary infertility and also secondary infertility. So nearly for infertility is not just this now only we have discussed about this is not so whole and soul of a female problem. 1/3 of all infertility, in fact half of the infertility is contributed by the male factor itself. So coming to the male infertility, and the definition is it inability to conceive cause pregnancy in a female partner. So epidemiology, coming to the what is the rate, and nearly 15 to 17% of all couple, they are not able to conceive within a year. Actually, the fertility rate should be 70% if they have normal sexual intercourse in the first year of their married life, if they are not doing any contraception. So in 50% of involuntarily childless couples, male infertility is associated with abnormal semen parameters like azoospermia, oligospermia, asthenospermia, globozoospermia, all these parameters we can see. So coming to the in Indian scenario, nearly 40 to 50% of fertility problems are due to the male. And again, every seventh male partner, male patient is suffering with the infertility problems. So here again, normospermia means that is normal. In these patients, in infertility patient, normospermia is good, 35%. And oligospermia, that means less semen count, is 34%. In oligospermia, we have severe oligospermia and mild oligospermia, and those divisions are also there. Asthenoteratozoospermia means the movement is less, that is only 20%. Azoospermia is almost 10 to 11%. Azoospermia means there is no sperm at all in the semen. So what are the problems that causing? And if we can divide very nicely, that is pre-testicular, testicular, and post-testicular causes. But anyway, and coming to the production of the sperm, they produce in the seminiferous tubules in the testis, and they will collect it in the epididymis, and that is a very big structure, and that is all coiled structure, nearly about 6 meters of coiled structure, and that part will preserve all these sperms, and sometimes most of the time the maturation will also occur in that place, and from there it will go into the vas deferens, from there seminal vesicle, from there again it will go into the prostatic urethra, and semen will come to the normal urethra for the reproduction. So these are the things. Here we can see so many structural abnormalities of the sperms and also production disorders. And coming to the production disorders means again we have to see the testis as well as the endocrine factors and ejaculatory disturbances. Here again psychological problems, stress problems will come. Of course, immunological problems, they cause lot. And coming to the always we talk about
Stavan,
हाँ निशांत,
कुछ टेक्निकल इश्यू?
Okay, so we'll wait for ma'am. So,
Yeah.
Lakshmi garu, please coordinate with ma'am so that we can ask her to rejoin.
Okay. Delegates, wait for a few minutes. There was some technical issue. So the speaker will join within few minutes. Please wait for 2 to 3 minutes. Till then, let me show you our page Shield Connect. So this is our page shieldconnect.in, where you can find various sections are available. And recently we have also won 3 new awards. And the first section is the blog section, where you can find all the blogs written by the eminent speakers and doctors. Then we have a webinar section, upcoming webinars and past webinars. So you can go through the calendar and can check the webinars that we are conducting. Then in the past webinar, you can find all the webinars that we have conducted in past. Then we have 4 awareness pages. So if you click on the first page, that is PCOS awareness page, you can find all the details regarding PCOS from different doctors in various languages like Hindi, Tamil, Malayalam, and other. Then we also recently have updated menopause awareness page, where you can find all the uh, videos related to menopause. So you can go through this series, and we also have a blog related to it. Then we have our leader page, where you can find all the top key opinion leaders who are connected with Shield Connect page. So this is you can go through their profile who are connected with Shield Connect. Then this is the special day pages. So we have various days related topics available. Like if you click on hypertension day, you will find all the videos related to hypertension, infertility, or in pregnancy. So this is our page Shield Connect, and please wait for few minutes. We will get back to you. And participants, you can also post your queries in this comment section. Like you can see this is a recent webinar which is going on. So in this comment section, you can post your queries. So at the end of the session, we can have a Q&A session with our speaker. Thank you. Dear participants, please wait for few 2 to 3 minutes. Madam is connecting. There was some Wi-Fi server issue from speaker end, so she will connect back. Thank you for waiting. Participants, speaker is joining in few minutes. Till then, we are sharing some videos of our products. So, Stavan, please share the videos. Till then. Stavan, you can share the video.
Yes, yes, I'm ready.
Yeah. Dear delegates, sorry for the inconvenience. We apologize. Please wait for more 5 minutes. Ma'am is going to join. Thank you for your patience. Dear delegates, just now we got a message from a speaker. Actually, she had an emergency call for the patient, so she have to leave the webinar, and the this webinar will be rescheduled again. So we very apologize for the inconvenience. So thank you for joining Shield Connect, and we will come back with this topic again in next week. So thank you so much. Bye.